Well, welcome back to the Senior Hour. I'm Barbara Cochran with my co-host,
Dr. Jane Dorio.
on your hometown station, KHTS. Yes, I did it. Our next guests this morning are Dr. Wittig, a urologist, and Mandy Eglesider of City of Hope.
Welcome to the show.
That's a heck of a last name you have, young lady.
It is German. Did
Did I say it right?
Close. Eglesider.
Eglesider. Eglesider. Interesting.
So today, City of Hope, many doctors from City of Hope have been on this show, and they're not really new to the community as far as me getting consults for them and from them, but for the community it's rather new. And City of Hope has always been known to be on the forefront and the edge of science, technology, and medical treatment. It's great. And the fact that one of the problems that I think our seniors face, urologic problems, and Dr. Wittig, that's your field. And
Correct.
We're thinking, let's see what urology problems are there that our seniors face, and it's a whole potpourri. For gentlemen, it's prostate problems. For both, it's incontinence. What are the things that you think that as our seniors are looking at life and moving ahead, what's one of the main problems that you see in our elders?
The most common things, non-cancer, are enlarged prostate in men, which could result in urinary retention, infections, incontinence, or it could, in females, it's similar problems due to either overactive bladder or pelvic floor disorders leading to incontinence and also urinary tract infections.
Yeah, so the main thing is, just to translate a little bit all the terminology, though, is that when you are trying to urinate, you can't urinate, and when you don't want to urinate, you do urinate.
Correct.
And because this becomes a sanitary, hygienic type problem, and sometimes an embarrassing problem too for our seniors, there are things that we can do to take care of these problems, sometimes with medicine, sometimes surgically, and sometimes through maybe even exercise of certain muscles. So let's go through some of these things specifically. Let's talk about the guys first, and prostate. And you mentioned retention, and the prostate enlarges so much that when you try to urinate, sometimes you can't urinate. And that in itself is frustrating and difficult, and could be even painful if the bladder gets enlarged.
So usually, most of the time, not 100% of the time, but you would get some warning signs. Men will present with slow stream, urine. They have to push and strain to urinate, and they might get up too many times at night, going frequently during the day. If you feel the urge to go, you got to go right away. The long car rides become difficult because you have to stop. You have to stop multiple times. So those are usually when people start noticing those symptoms, is when they interfere with their quality of life.
Sure, and you can get bladder infections as well. And if you're starting to get 2 or 3 at a time, you got to be thinking, I'm not emptying my bladder, and this could be a problem.
Exactly. So when you start getting these warning signs, and you notice that if they're mild and you're okay with getting up a few times a night, it's okay. But if they're starting to become bothersome and interfere with your quality of life, that's when it's time to seek help. And there's medications that we can give, which would be the first line of treatment to relax or shrink the prostate, or both. And most of the time, the medications work pretty well. And if they don't, or if the prostate keeps growing and the symptoms keep getting worse, then there's other surgical options that we can also discuss. But the medications is usually the simplest first-line treatment.
And we're making a lot of headway in helping with prostate problems in terms of new surgical procedures as well. But, we're not going to go in depth of those. That's just way beyond the conversation. But with some of our women, they will have problems with of not being able to hold their urine, and a lot of it comes from pregnancy and delivering their babies. And now they're going, hey, wait a second, what's this going on with me now? What's that smell? What's that stain? And no, it just becomes too much for some of our senior women, especially sometimes our guys too. How do you evaluate those patients?
So usually in women, there's two types of incontinence. There's either what we call stress incontinence, is where you're coughing, laughing, sneezing, and jumping, running, and you're leaking at the same time. So at that point, women will come in and say, I can't even run around with my grandkids because I go on myself, and that's embarrassing, uncomfortable, have to wear a pad. Or there's another type of incontinence called urge incontinence, and that's due to overactive bladder. So that's when you feel the urge and you just can't hold it, you have to go right away. And some people have both types of incontinence, especially if you gave birth, have several children, your pelvic floor muscles relax. That's when you end up with the stress type of incontinence. The overactive bladder commonly occurs, after menopause. Younger people can also have that problem, the overactive bladder, but see it a lot in the older women, and they're treated differently. The stress incontinence is usually, that's when we can do that you mentioned exercises, which is the pelvic floor strengthening therapy, and there's special physical therapists who actually do that. They specialized in those programs, and they put you through exercise regimen, and sometimes that alone helps. Sometimes we can talk about different surgical procedures to fix the problem. And then the overactive bladder, we usually start with medications that help relax the bladder a little bit, so that to decrease the frequency of urination, so you can hold more urine in and not feel that urge sensation. And if the medications fail, then there's also surgical approaches that we can take, for example, injecting Botox into the bladder or doing sacral nerve stimulation. Those types of treatments usually pretty effective also.
Interesting.
And the urge one is if you remember that commercial a few years ago, gotta go.
And that's the medication, yes.
And that's where when you see these, especially guys, are driving around and they got a little Johnny in tow behind them. I mean, it's a great commercial, I think. It sure gets your attention. Yeah. And, a lot of our seniors go, I gotta go. And, that's something they want to solve. But, what is frustrating, I think, for our seniors is they don't want to go on medication.
Yeah.
They rather try to treat it with some kind of exercise and maybe even surgically.
Yeah.
But like the last thing they want is, one, having side effects from the medication, and two, sometimes they turn around and, a month's supply has gone from $30 to $60. They go, wait a second, that urge just got a little less now because of the price of the drug.
Yeah.
So, but we have to be aware of all the options, don't we, Dr. Whitty?
Correct. And with the different types of medication, first we have to rule out that you're not retaining urine causing all these symptoms before we start any type of medication to relax the bladder. So that would be easy way to do with a little ultrasound test in the office. And if you're emptying your bladder well, then that's when we say, okay, you can take the medication. Of course, each medication has side effects, so we have to carefully evaluate each patient before we start the medication, because certain medications are not appropriate with certain other medical conditions. Right. And if somebody has certain dementia issues, you can also not use certain medications. So it has to be very careful coordination between the primary care physician and the urologist, and has to be frequent monitoring to make sure that the medication is safe. And cost, of course, is an issue, so we have to work with insurance companies to make sure they approve the appropriate medication. So it's a little bit of work goes into that, but we usually manage to find the regimen that works for people.
That's good. Mandy, what part do you play in City of Hope?
So I am physician relations liaison. I actually work with our doctors in Santa Clarita, Mission Hills, Simi Valley to connect them into the community. So, for example, I'll take Dr. Wittig out and introduce her to other doctors in the community. We'll participate in community events and show that we're here as a community partner. So a lot of marketing and outreach in our community.
Very interesting. Now, do you live here?
Yeah.
You do.
Yes.
So you
not born
know-
and raised, but
No, but you know what goes on,
Yes.
and it's a very, very busy
it
city.
is. I don't think I have a free weekend until December, maybe.
Yeah, I'm sure of that, because this is a very active community, and we have a very active senior community up here, as you know. I mean, we have quite a few senior facilities, apartment housing areas up here, as well as the large one, which is Friendly Valley. And so, well, that's good. You know, you are the only person I thought was coming on. I didn't realize that a doctor was coming on. But what a great combination.
Yeah.
So, do you live in the area, Dr. Wittig?
I will be soon.
You will be soon.
Yes.
If you can afford it.
Well,
Prices are
I
going
don't know.
up
It's cheaper,
daily.
it's cheaper than Glendale, where I live
Yes,
currently.
I was going to say.
Yeah.
But
Yes.
you're absolutely right. It's definitely scary.
Yeah, it's getting a little more expensive to live here, but it is definitely less expensive than living in the San Fernando Valley area.
Yeah.
It really is, and it's a wonderful community.
It's a great community.
It is.
really
I'm looking
is.
forward to, yeah.
Because
moving here.
I've lived here since 1968, before the 14 freeway was put in. I
Yeah.
live,
Wow.
used to ride motorcycles up the hill where the freeway is. Oh yeah, I sure did. My boys and I, we did. We got on those motorcycles and scooted up the
That's
end of the
great.
street. But now that's not occurring because I'm older and don't do that anymore. But now we have the freeway. But it is, we have really grown as a community up here. I know when I first came up here, we had very few doctors up here. And a few of us in the community formed the health council to try to reach out into areas other than the Santa Clarita Valley to try to get doctors and dentists and psychiatrists, and it worked very well.
And speaking of that, as urologists, we just started coming to Santa Clarita maybe 6 months ago.
Yeah,
or
September.
September.
Yeah, September of last year.
So
Almost a year.
this is also kind of new community for us.
Right.
We have a well-established practice up in Lancaster, Palmdale area, and decided to expand our services. And it's great because we try to keep everybody in the community. You know, we operate and do everything out of local hospitals, but at the same time, we do have City of Hope available to our patients. So for difficult cases, complicated surgeries, clinical trials, that's all available for our community patients also, which is great, so they don't have to travel to Duarte to get that level of care. They can do all their follow-ups locally, and it's just a great thing for people.
City of Hope has had oncologists here and surgeons here for probably the past decade, but now that our city is evolving, I think there's a true increased need across the board for many other specialists. And one of the things we really should talk about that our listeners are always concerned about is cancer. Bladder cancer, prostate cancer, kidney cancer. These are the things that they live life every day and think, my father had prostate cancer. Am I going to get that? And that's one of the big issues that are out there, and it's controversial as well. How often do we treat, and how aggressive do we treat it?
Yeah, the good thing is we have guidelines for everything, so I feel if you stick to the most current guidelines, you can't go wrong. So that's how we work at City of Hope. We usually, all of us go to the latest meetings. We're on some guideline committees, and everybody's up to date on all the recent information. We always get the latest technology. If the new treatment or equipment comes along, we always get that. So I can definitely say that we are on the cutting edge of cancer and other treatment. So with prostate cancer, it's a little tricky, and you certainly have to tailor it to each patient. There's a lot that goes into deciding what way to go if you do diagnose somebody with prostate cancer. Of course, age, health, and other medical problems that the patient might have come into play when making that decision. But and of course, person has to be comfortable with what we're recommending. But it's just a lot of individual approach also. So you know what the recommendation is, but then you also have to tailor it to individual person to decide what you're going to do.
our local hospital here now has the advantage because technology has come here with robotics, and people have heard about how it's mechanized now, but they don't know too much about that. Can you elaborate a little bit of what our hospital is doing and what the role it might play for some of our senior men in terms of surgery?
So Henry Mayo Hospital is purchasing a Da Vinci robot, and this is a prostatectomy or removal of the prostate has been done robotically for a long time now, and that's, I guess, the most current recommended surgical approach for prostate cancer. And it's minimally invasive. It's all done, I guess you can think about it as laparoscopic surgery, except that it's done with a robot, which is a machine which allows you better visualization. It's 3D, better visualization. You're working deep in the pelvis, so you can see all the structures very well. It's you have a lot more manual dexterity with the robot, and it just makes your life a lot easier. And for a lot of other surgeries, for example, we do pretty much everything robotically. We reserve open surgeries only for really large tumors, which you cannot do minimally invasively. But kidney surgery, whether it's removing the whole kidney or just piece of the kidney, removing the bladder, that's all done robotically now.
And I'm going to date myself a little bit because when I first started, I was in surgery, and I happened to do a rotation that came out to Henry Mayo. Didn't come out to Henry Mayo, but it was Northridge and Holy Cross. And the dissection that we had to do relative to all the procedures that were urologic was very difficult because of visualization, things like that. So, it's interesting. Well, when we come back, let's talk a little bit about the other cancers, the bladder cancers, the kidney cancers that are some of our patients are afflicted with. I'm Dr. Gene Dorio with my co-host Barbara Cochran on your hometown station AM 1220 KHTS. Are you?
Good morning again, and welcome to the Senior Hour, and it's almost noon.
The day after the 4th of July.
That's right. And we're speaking with Dr. Wittig, a urologist, and Mandy Eggleseder.
Got it.
From City of Hope. Wonderful. Well, Mandy, before we get back to Dr. Wittig about the cancer situations, how did you get involved doing this kind of work?
Well, my history starts back when my stepdad was diagnosed with bile duct cancer about 11 years ago, and I actually stumbled into Relay for Life events, which led me to working for the American Cancer Society in Santa Clarita for about 3 years. Heavily involved in the cancer community, and then here I am with City of Hope, working directly with connecting patients to doctors to the best cancer care. So I feel, I do this in memory and in honor of my stepdad for his legacy, and it feels really good to do this kind of work.
Oh, I bet it does. And you're acquainted with all of the doctors up here, and that's wonderful. Yeah. And you're able to give feedback to the City of Hope doctors.
Exactly.
That's great. And what a wonderful memory.
It's really rewarding.
It really is.
Yeah, I absolutely love it.
That's wonderful. Well, so good. I'm glad that we got to talk to you a little bit about that. Because I wonder, with the doctor coming in, we've talked about all of the doctor stuff, and still have a lot more. But I'm glad to hear that. I think that's wonderful.
Thank you.
That you did that in your stepdad's memory. Wonderful.
Congratulations.
And Dr. Wittig, we were going to talk about, I think, the different kinds of cancers.
Yes.
We have about less than 2 minutes.
So a little bit about bladder cancer. So most of the bladder cancers, not most, but a lot of bladder cancers present with blood in the urine, either seeing blood grossly or seeing it under microscope when your primary care doctor does a urine test. And if that happens, then they have to refer to a urologist to get evaluated further. Also, sometimes when we talk about the urgency and urge sensation and urge incontinence, that could also be sometimes a sign of bladder cancer. So if it's something that happens out of nowhere and you start getting those symptoms, then we also have to rule out something more serious than just overactive bladder in certain cases. And then those bladder cancer is pretty aggressive, so there's different types of bladder cancer. Some of them are aggressive, some of them are less aggressive. So we
But the earlier you find it, the better off you are.
Yeah.
So that's the thing. You start seeing signs, don't ignore it.
Exactly, especially blood in the urine. Go see your urologist right away. Don't ignore it. It's definitely not normal.
And kidney cancers are there, and sometimes symptoms evade all of us, the patient, the doctors. So it's not an easy diagnosis, is it?
Yeah, a lot nowadays with everybody getting CAT scans for other reasons. Usually, most of the kidney cancers we're lucky we're able to catch early, and we're able to, as an incidental finding, and we're able to take care of them before they spread and become bigger problem. So usually, and we're most of the time able to just remove part of the kidney because we do diagnose them early.
So real quick, Mandy, phone number for City of Hope if any of our listeners might be interested. You
Yeah,
have a local one there?
Yeah, the local number is 661-799-1999.
Oh, that's easy.
Yep.
Very good.
A lot of nines.
799-1999.
Exactly.
Well, Dr. Wittig, Mandy, thank you both for being here today. It's given us a lot of information, especially urologic problems that our seniors face. It's always something that's timely and necessary. I'm Dr. Gene Dorio with my co-host Barbara Cochran on the Senior Hour. And make sure you have a great day and a happy 4th of July from yesterday.